heard about it before then. And so after hearing her experience and kind of her journey and her process, I really became interested in the field, talked to some professors, talked to my genetics professor at Center, who said, yeah, this is a field that it's a growing field. It's expanding rapidly, something that if you're interested, I encourage you to explore it further. So that's kind of how I first heard of genetic counseling, and how I kind of got involved. While at Center, I was a biology major. I did do research over the summer between junior and senior year. I got to live on campus. Following graduating from Center, I did do an internship in shadow at a center here in Louisville, to get some experience and to make sure that if I was going to go to grad school for genetic counseling, that it was what I really wanted to do. Because it wasn't until around senior year that I decided that it was something I wanted to explore further. So in between that year of graduating from Center and heading to grad school, I shadowed, I did volunteer work. I worked at the Kentucky Science Center here in Louisville. It was really fun. So just did a variety of things to kind of help me make sure that that was the right path for me. I applied to, I think it was like 8 to 10 programs, which is, I think, pretty typical as far as how many people apply to. And then I got interviews at a couple of those. When interviewed, and the process for acceptance is a little bit different now. It's a match program. But when I was interviewing, that wasn't the case. So I got some phone calls. I was accepted into programs, and then did eventually decide to go to the University of Cincinnati, again, housed in Cincinnati Children's Hospital. I had a great experience there. All of the genetic counseling programs are all developed and designed to set you up for success. So there isn't really any programs that are better than others, or any programs that aren't as strong, but they are all set up differently. So you do have to find programs that match with what you're interested in. Like some programs allow you to do rotations offsite for a year. Some programs like Cincinnati have you do all your clinical rotations in the same city. So it's really like a personal preference as far as what you prefer to do. After graduating from the University of Cincinnati, I took my current job here in Louisville with Norton Healthcare. I work in a maternal fetal medicine clinic. It's a high risk obstetrics clinic. So I'm mostly dealing with pregnant patients who either already have a child with a genetic condition, or potentially their pregnancy could be affected by a genetic condition or something like that. So I talk with them about their options in terms of learning more information, further testing, further screening, that sort of thing. There's a lot of different fields that genetic counselors can go in, and Cara's going to talk a little bit more about what she is. It's a little different than what I do, but you do get trained in pretty much all different specialties, so you can go into anything that interests you. I think that's kind of the gist of my story. So I can kind of turn it over to Cara and let her take it from here.
Thank
All
you,
right,
Paige.
hi. Oh, sorry. Yeah, thank you,
no,
Paige.
thank you. Yeah.
So I graduated from Center 2 years after Paige. I graduated in 2018. I had a major in biology and a minor in anthropology. I didn't hear about genetic counseling until college either. So I came to Center thinking I wanted to do veterinary medicine. And then it was my genetics professor, who I think was the same one that Paige had, that like mentioned genetic counseling to me. And I talked to her a lot about like desired career path goals, like what was important to me in a career, what type of interactions I wanted, if I wanted to do research or not, things like that, which is how I landed on genetic counseling. So I came to that realization probably, I think it was like fall of my junior year. And then at the same time, coincidentally, I was going through training to become a sexual survivor advocate and do like hospital work as well as crisis line calls. So for me, that was really beneficial because it gave me a piece of advocacy experience that genetic counseling programs look for. So my like timeline's a little different from Paige's in the sense that I kind of like decided I wanted to do this while at Center. And then hustle to get everything in line so I could apply during my senior year. So I had done research with a biology professor at Center between my sophomore and junior year. It was completely unrelated to genetics. It was on freshwater ecology. So not related, but still having that research experience was something that programs like looked favorably upon, just because like you all know the backbone of research is the same. And then between my junior and senior years at Center, I interned with a cancer genetic counselor in Lexington, Kentucky. So I lived at Center during the summer and then drove up there a few days a week and shadowed her, watched different cases, things like that. So by the time I was ready to apply, I had both like research advocacy as well as actual shadowing experience. Similarly to Paige, I applied to, I think, 8 programs across like the US. I don't remember the exact number of genetic counseling programs. Currently, it's around 40 something, maybe 42 now. And there's new programs typically that are accredited every year. So like Paige said, also, it's a rapidly growing field. So probably from the time like both of us applied, it's grown by maybe like 5+ programs in that time. So I applied to around 8 programs, interviewed at a few, and then I was part of the match system for programs. So basically like you interview at all the programs you get interviews at, and then you rank them in order of preference. And the programs create rank lists of all the applicants, very similar to Greek life at Center. If you know about the Greek life system, obviously that just happened at Center, I heard. So if you've gone through recruitment, you have a really good idea of what the match system is. It's basically that. So I ranked the programs I interviewed at, and then I ended up matching at Ohio State. So I went there for my master's degree, and I actually just graduated this past May. So while I was in Columbus, we did like most of our rotations in Ohio, but then for our program, if you wanted to leave Ohio and do like a clinical rotation elsewhere, you could. So I tried to go abroad. It didn't work out, but I did rotate at Cincinnati Children's last summer, actually, or 2 summers ago now. So I knew I liked the hospital here. And then throughout grad school as well, I guess like a general tidbit to know is you don't have to be decided on like what exact specialty of genetics you want to go into when you apply to programs or start programs. I thought I would want to do cancer genetics because it's what I had exposure to. But now here I am like fully embedded in a cardiology clinic and I really love it. And I didn't really realize that that would be something I was interested in until the second year of my master's program. So currently I started in June, I think, in the Heart Institute at Cincinnati Children's. So I'm part of a team of 3 genetic counselors, and we solely work in the Heart Institute. So I only see patients who have a risk or a family history of any type of inherited heart disease. So that could be things like what you think of stereotypically with heart disease. So like coronary artery disease, risk for heart attacks. I see babies with heart defects, older people with heart defects, people with rhythm problems, heart muscle problems, really anything where the heart is involved, we might see them. A big part of my job is also being involved in like clinical research. So I'm on a few different research projects, either like retrospectively reviewing patients and reviewing the genetic data and things like that, or collecting new information on how genetics is integrated into the hospital, things like that. So for me, research was something that I really wanted to be involved in my career. So that was a big consideration of mine, was I didn't want to just do clinic work. I also wanted to be involved in research. So also like Paige talked about, within genetic counseling, there's lots of subspecialties. You can do just research, you can do just patient work, you can do a combination, or you could even work for a genetics laboratory. The degree really sets you up for a variety depending on what you're interested in. And you get exposure to basically all of those things throughout your training. So you're ready to go out and do basically whatever interests you. Which is kind of how I ended up where I am now. I think those are the big things I wanted to cover. The one other thing I wanted to mention in regards to like choosing a program, exactly what Paige said, they're all slightly different. They're all accredited by the same like organization. So they all are like equal in that sense, that you will graduate and you'll be eligible to sit for a board exam so you can become a board certified genetic counselor. So like for us, some states, including Kentucky and Ohio, have licensure. So you have to be board certified to call yourself a genetic counselor. All the programs you're looking at, or if you're going to look at them, would have that. The difference would be like some programs are much more like clinical focused, some programs are more research focused, some programs are just a good mix. And that was a question I asked during a lot of my interviews, was what the mix was in terms of priorities of the program, just so you can find something that matches what you're looking for. I think that's all I have for now.
Okay, thank you both, Paige and Cara. That was good information, good stuff to have. Looks like Paige, we scared her off. No, she said she had to go get a phone call, but I think she'll be back. But this is a chance for you guys. I know we have a small group, but hopefully an enthusiastic one there, for you guys to ask them specific questions that you might have. And just be sure to unmute yourself. I like to talk sometimes without unmuting myself, and that's easy to do on a Zoom. But do we have any questions for you guys? Don't be shy. Yes.
Hello, thank you so much. This was very informative. And I'm Anahit, by the way. I'm a sophomore, a biology major, and I'm very interested in cancer genetics, at least for now. And I have never heard of genetic counseling, to be honest, until this talk. So thank you for that. So you mentioned that you applied to like at least 8 to 10 programs after your graduation. Now for the summer, I'm looking for internships, and I was wondering how do you find stuff? Do you like apply through one organization to different things, or like find specific programs within different organizations?
That's a really good question. There's not like one specific organization that coordinates internships. This might be like sound kind of surprising, but for our generation, it's probably not. There is a lot of like advertisement of genetic counseling internships on Twitter, if you're on Twitter. So hashtag GCChat is like a great thread to like scroll through to see if people have posted about internship opportunities. I don't remember any specific ones, but I know like there even were some paid opportunities for this summer. The only specific one I can think of is there's one through the University of Iowa and one through the University of South Carolina. So you could look up those specifically. Otherwise, in terms of my internship, so I basically was like shadowing a counselor and then would help her with random assignments. So whether that's like sending out patient letters, touching up pedigrees, things like that. So I found her through the National Society of Genetic Counselors website. So if you basically just Google find a genetic counselor, it'll link you to a website where you can just search for genetic counselors anywhere in the US. And there's a little box that will tell you information about them. So if you were to find me, you'd see that like I'm in cardiology, I can see patients via telehealth, and I'm open to student contact. So what I had done when I was looking for internships is I pulled a list of like 10 GCs from that website who said they were open to student contact, and just cold emailed all of them and asked if any of them would have me. Most of them didn't respond. Some of them said no. Other people tried and it didn't work, kind of things like that. But you kind of just really have to like put yourself out there and do a lot of, I don't know, like underground research to find something almost. I think internships like formally are becoming more common for genetic counseling. But the more you just like Google into it, I think the more you'll find. I don't know if Paige has any more intel on like internships or shadowing opportunities.
Yeah, so I think kind of what I caught at the end of what Cara was saying is that sometimes it can be hard to find genetic counselors to shadow just because we're mostly concentrated in like urban areas, just because it is a smaller field and that's where the big hospital centers tend to be that hire us. So it can be difficult. So if you aren't able to get an internship, a lot of programs do like to see if you like have a conversation or do like an informal interview with genetic counselors. Like I have done Zoom sessions with students who weren't able to find a genetic counselor to shadow. So even if like for some reason it just doesn't work out, at least having a conversation with a genetic counselor, doing something like this is great, to kind of get that insight about the job. I know when I was trying to find people to shadow, I had similar experience. Like some people didn't respond, some people said no, some people said we already have 4 students from programs coming to shadow with us. We're at max capacity. I had a couple people direct me to other people, and that's eventually how I found someone that I could shadow. Was just someone was like, I can't take you, but my colleague might be able to. So it can be a little tough. I will say it's becoming a lot more common for people to take on what's called a genetic counseling assistant role. So some people who don't move into the genetic counseling programs right out of school can apply to be a genetic counseling assistant. And a lot of the big laboratories hire these. And basically it's someone who is there to help the genetic like basically a genetic counselor assistant who can just help with some of the more things and kind of learn more about genetic counseling through that role. I had a classmate that was one. He really enjoyed it and he had a great experience as one. So if that is something that you're interested in, I know a lot of places are hiring for those now.
Okay, thank you so much. Good help.
Anybody else have a question?
This is a not as technical question, but what's what you most enjoy about genetic counseling?
It's hard for me to narrow it to one thing. So like from a professional standpoint, I really appreciate the community that genetic counselors have, because there's roughly 4,000, I think is the number that is out there. Genetic counselors, you really do get to like know people. And if you know someone, they know someone that knows someone. It actually kind of reminds me a little bit of Center, where there's just a lot of like connections to be made and a lot of people that you can get to know. So that's like from a professional standpoint. From a clinical standpoint, I had always had this sense that I would move into healthcare because I always kind of wanted to do the typical healthcare things, like make a difference and impact patients and really be a resource and be a strength, be a sense of like support for someone through a vulnerable time, which is a lot of things we do in genetic counseling. I just didn't know how to do that before I found genetic counseling, because I thought about nursing, I had thought about like PA school, I had thought about a lot of different things, and none of those seemed to be the right fit for me. But when I learned about genetic counseling, I was like, this seems exactly like what I've been searching for. I just didn't know what it was called. So yeah, from a professional standpoint, I really appreciate the community. And then from like a clinical standpoint, the interactions with patients are probably my favorite thing.
I think for me, it probably comes down to like interaction with patients and then also ability to do like research and deep dive into why things are the way they are. So I love working with patients, and I also, at least like personally for me, my patient load isn't overwhelming in the sense that like I couldn't take on a commitment like this, or I don't have time for research or things like that. So I really like that. I feel like I have the time to follow up with my patients right now, and I'm able to establish like stronger relationships almost, where I've had patients tell me things that they haven't told other providers before, and then we find out they need referrals to other people because they haven't felt like they were listened to before, or didn't feel comfortable sharing like what was really going on. So I think our field's different in the sense that, at least I would hope it is, in this way that we are like really strong advocates for our patients. And I think that's something that we pride ourselves on, is being the person that's there for them always, and like non-judgmental with decisions, things like that, since we are discussing sensitive topics a lot of the time. So that's one of my favorite things. And then also just the genetics aspect, which probably sounds cheesy, but I love getting interesting results back where it's like a variant in a gene that I might be familiar with the gene, but I haven't seen something specifically like this before, Or sometimes I get results back where I've never heard of the gene, and then I find out there's only like 200 people in the world with this disease, and I'm like, that is so cool. So that's probably the other thing that I really love about it, and still having time to read about like the mechanism behind the disease and things like that. So I feel like we're always learning because there's always new testing technology, new diseases being identified or described, things like that.
Thank you.
Just to jump in on the backside of that question while we're on it, and I'm not trying to be negative, but what do you like least about it too? Or what do you find the most, maybe perhaps challenging or difficult?
That's tough. Some of the things that I think can be difficult for genetic counselors, and this is kind of based on my own experience and also experience of my classmates and stuff, is that genetic counseling is considered to be a newer field in the field of medicine. It wasn't until like the 1980s or so when it started to come about. And there's a lot of places across the United States that haven't quite figured out the utility of genetic counselors and haven't quite figured out like how exactly we can be used at the top of our scope of practice. So sometimes I do find like that I'm being directed to do things that aren't quite within my scope, if that makes sense. Not quite things that I'm trained to do, but things I'm capable of doing because of the skills I was taught in my genetic counseling program, but things that might not quite fall within my scope of practice or don't allow me to do my job at the very, very top of my capabilities. So I'd say that's probably the more frustrating thing that I've encountered. I've learned a lot to not only be an advocate for my patients, but also for myself, which I find it harder to be one for myself. Just because it's hard for you to say, look, this is what I need in a work setting, and this is how I need to have it. But I've learned to do that within my last year and a half of employment. I would say that's probably the more difficult thing, is just trying to help other providers and other people quite understand what your role is.
For me, it's probably when I like give patients or families information about risk for disease in the family, and then they choose not to pursue like additional screening, which is their choice. So like specifically, sometimes I'll tell families like, oh, you have a 80% lifetime risk to develop heart muscle disease, which is a serious thing, and we'd like to see you or your kid every year or every 2 or 3 years and things like that. For the kids, it's not so much a thing where they don't follow up because like legally they have to, or it's negligence and stuff. But like I've had adults where I'm like, oh, you're at this risk, like you need to see a cardiologist, things like that. And they're just like, I'm not too worried, I'm not going to do it. And I like, there's at that point, like there's not much else you can do besides just give them the info. And that's something where whenever I get off calls like that or talk to patients where they're just not interested, it's hard for me because it goes against like my personality and my wishes, which don't matter. It's the patient's choice. I mean, as long as they're informed, it's their decision. But I think I typically like get the most down or have a hard time when patients just kind of like, we have different views on things. I think that's when it gets hard for me.
This is your chance. Oh yeah.
I was just wondering, I'm an international student, so I'm not sure if I will stay in US. Like, I don't know where I will end up in the future. And you mentioned that the field is pretty new, like it's not that maybe like developed, I guess. Do you know like the development of the field internationally? Like, is this something that I could pursue like in other countries, or this is mostly like US based?
So I had looked into doing like a rotation abroad. So I've looked into this some. There are like American board certified counselors in Australia, New Zealand, and South Africa, which is very random, but those are the 3 countries I know of at least. In Australia, they have like their own genetic counseling programs, but those genetic counselors go through more training where they like, after they finish their clinical training, they stay on and like are required to do research. And most genetic counselors in Australia have a PhD. And that's required for them to practice, which is a slight difference than our like master's programs here. I've heard that in Europe, in some places, the role is filled more so by people who have like backgrounds as nurses. I don't have any more specifics on that. I don't know if you know about any other specific countries, Paige. I know there are genetic counselors globally, but it kind of varies.
Yeah, I know that there is a American board certified genetic counselor in Singapore, because I have a classmate that was from Singapore and I'd done shadowing with her. I know there are genetic counselors in the UK. I'm not totally sure like how their training is or kind of what their process for certification, if they have that or anything like that. And then yeah, Australia and New Zealand are the other ones that I've kind of heard of. So it is, I would say like globally, it is also still an expanding field probably in these other countries. I'm just not quite as familiar with how that is going as compared to the US.
Okay, thank you so much.
Yeah, no problem.
And I would add that you probably would want to try to research, country specific. And when you do that, sometimes what happens is the universities or training facilities will pop up, and then you can contact them and they're going to know more about the climate in that country. And come make an appointment with the Career Center too. We can help you sort of navigate that, or at least expand upon it. You guys gave good information, but maybe we can help you a little bit more with that.
Thank you so much.
Sure. Other questions? I'm going to start asking questions if y'all don't ask questions, and my questions aren't as good usually. So this is your chance. You got two experts here in the field. Don't be shy.
Okay. So you mentioned, oh, sorry.
No, go. You win.
You mentioned doing research before, like research at Center before applying to grad school. Would you highly recommend doing that, or is that just something that you did and you found was helpful getting in, or?
So to talk a little bit more about mine was also totally unrelated to genetic counseling. It was about salamanders and like phylogenetics and stuff, which is, I guess you can make the stretch, but really did not have a lot of connection to like genetic counseling at its core. The biggest benefit I got away from it is that it really helped me realize that I did not want to do bench lab work. It really helped me realize that like, okay, if I'm going to do research, it's not going to be in this way. It's not going to be running gels and doing PCR and pipetting for hours and hours. That helped me realize. It was something that came up a lot in my grad school interviews. So I think programs were happy to see it. And that was mostly what I talked about when I said, I did this. This was the outcome of it. It helped me learn that I didn't like that. And I think that's okay to say, because if you have concrete experience to show you why you didn't gravitate towards a certain thing, I think that's also beneficial when it comes to interviews and stuff like that.
Yeah, I don't think you necessarily have to have like a summer research or semester-long research experience. A lot of programs will ask about it. You probably like could make the argument that you knew from like your classes that had a required lab that you didn't like it. But I don't think it's a bad idea to do it. At Center, it was nice because I got funding through Center and lived on campus for free, which was like really fun to be there with all my friends. So like it wasn't a bad experience, but I don't think you like absolutely need to have it if you're going to be applying.
Thank you.
Kind of speaking to that, applying to graduate school, are there any other key elements that you would point out, grades, or not grades, but key courses that you need to have that might be good to get now?
Some programs do have like prerequisite courses. Some programs don't have any. I know for like the University of Cincinnati, they have like some recommended courses, but like none of them are requirements. Like one of my classmates was an education major, another one was an English major. You don't have to have like a science degree in order to be a genetic counselor. you have to be able to keep up with the science courses at a grad school level. So it is good to have like some courses at a college level to build on when you move to the grad school level. So, and of course they do look at GPA. It is fairly competitive in the application process. I would say, I think it's like 30% of people that apply end up getting in. So it is fairly competitive. You do want a good GPA. Most programs do require the GRE, so you want to score well in the GRE. Cara has touched on this a lot, but a lot of programs like to see advocacy experience. I volunteered for Crisis Text Line in that gap year, and that was a really great experience for me, and also something I could talk about in my interviews. They do like to see some of that shadowing experience as well. And then if you can't get like an advocacy specific like volunteer role, they do like to see just volunteering in general. Like I volunteered at a camp for individuals with disabilities, and that was a really awesome thing that I could talk about in my interview because a lot of those individuals had genetic conditions. So it was really great to be able to talk about that. There's probably other things too. I'm not sure.
Well, that's good to know. That's good. I didn't realize they took people from such diverse backgrounds and didn't really require any prerequisite. I mean, obviously you want to do the prereq to be able to handle the work, but that kind of surprises me.
I definitely think if you have like a stronger background, it might give you a little bit of an edge. Not to say it's necessary, but like, I know for me, I didn't apply to like 1 or 2 programs because they required organic chemistry 2, and I only took organic 1, and I wasn't going to take organic 2. So the biggest thing to like prepare yourself to applying would be to look on the American Board of Genetic Counseling website and look at the list of accredited programs, and then basically like pick out ones that either are like locationally interesting to you or things like that. And just like stay organized, I would say. Like I had a document where I like had a list of the programs, a list of the cost for each of them, application fees, required courses, and then like what it seemed like their emphasis was, just because there are a lot to choose from. And like when it comes down to it, you're going to have some type of decision on which you would prefer. But it definitely just depends on like each program, what they look for. I know Ohio State, when I applied, required the GRE, but they have since gotten rid of it, just due to like national conversations about how it really isn't a good metric of patient or of student success. So it's not all programs require the GRE anymore, which is kind of nice. It depends, but yeah, I would just say like start researching and writing things down and things like that.
Something else I forgot that most programs require are 3 to 4 letters of recommendation. And for mine, I had 2 professors from Center write them. And then for my third, it was with the genetic counselor that I had shadowed over the summer. And I think that's pretty typical as far as like who writes the recommendation letters, but like other good things would be like, if you do advocacy work or volunteer work, like someone who is in like a supervisory role would be a good person. Professors are great. People you shadow with are great. Those are all good options as far as like who can write those letters. My 3 recommenders were willing to do them for all the programs I applied to. So that was great. I just had to let them know when I was submitting the application, and then it sent them a link for them to fill it out.
Yeah.
I was wondering, how did COVID affect your like the way that you do your job? Like, do you do the counseling online, or how does it work?
That's a great question. We're still in the process of figuring a lot of it out. But I have mostly moved my visits to virtual visits, where the patient is usually at home and then I'm in the office. Because I work in a clinic where it's a multidisciplinary clinic where they're seeing multiple different types of people at a time. So they might talk with me, and then after they talk to me, they talk to the doctor, they get an ultrasound to check on their pregnancy. So I'm usually seeing them about a week before they come in for their ultrasound. So I'm usually the first person they're interacting with, the first person that they're asking questions to. I'm telling them why they're coming to see us, what to expect when they get here, options that we have for further genetic testing or screening during their pregnancy. stuff like that. Mostly have moved to virtual visits. I'm not able to use an interpreter over our virtual platform. So anyone that does, any patients that do need an interpreter, I do see in person, just because that's the only capability we have at this time. And then I do sometimes have urgent slots that get filled, whether like if it's a patient that maybe something was noted on their ultrasound that could be concerning for a genetic condition in the baby, then I will talk to those patients usually immediately after their ultrasound in the office.
So since I graduated in May, I was still in my program when COVID hit. So that was a little wild. All my classes were virtual. My rotations were virtual. I did my thesis defense virtual. So for my Ohio State program, you have to do like a formal thesis defense and submit the paper to the grad school for approval and stuff. So all that was virtual. My graduation was virtual. I basically like didn't see my classmates after we got back from spring break onward, but thankfully it all happened the day we landed from spring break, so it was okay. But otherwise, now from my job, it kind of depends on like the type of patient visit, similar to Paige. So I have genetic counseling only clinics where it's just me and the patient, and for those we're doing them all virtual over Microsoft Teams, so a similar platform to Zoom. And then for like the multidisciplinary clinics I'm in, most of those are in person again. At the beginning of my job over the summer, a lot of them were still remote when possible. So for those, we would just like get referred them. And then instead of seeing them in a multidisciplinary sense, we would just schedule them at a later date for genetic counseling only. So we've really liked the opportunity to do telehealth. So I know for our like genetic counseling only clinics, we're planning to continue to offer them over telehealth post-COVID, and are trying to make that a more long-term thing because it has allowed us to expand our patient services and see patients like from further away, see more people quickly, things like that, which has been really exciting. Otherwise, I mean, we wear masks at the hospital and all that stuff, but that's pretty typical across the board. I think those are the biggest effects COVID has had on us.
Thank you so much.
Any other questions? These have been some good ones. Well, with that, do you guys have any closing thoughts that you want to share with us? You've covered a lot. You don't have to have big closing thoughts, but just like to give you an opportunity.
I guess the biggest thing is just if you're even like remotely just a little bit interested in genetic counseling, I just encourage you to like explore it further, potentially shadow if you can. If you can't shadow, at least like touch base and talk with a genetic counselor about like their daily life and kind of what a day in the life of a genetic counselor looks like, just to get a better sense of what kind of patients are they seeing and what do those visits look like and what are they talking with those patients about. Because I don't know if that was something I had a great sense of before I shadowed a genetic counselor. So I think it's really valuable to get that, like those logistical details. Genetics is an awesome field. Genetic counseling is a great field. It's expanding. We are growing rapidly. And right now they say like for every graduate of a genetic counseling program, there's 3 jobs out there. The job market is very, there's a high demand for genetic counselors. Like for me, when I was looking for a location, I was able to pick where I wanted to work, which was Louisville, and I could pick any specialty I wanted to work in. Like I didn't have to come here and only work in the specialty I'm in now. I could have worked in any specialty. The demand was there. So that's a great thing to think about in terms of like outlook and job growth potential and stuff like that.
Yeah, I think I'd just echo Paige and say like the more research you can do into it to get an understanding, the better. Don't be afraid just to reach out to people, and like any conversation you can have with a genetic counselor is going to give you a slightly different perspective, which will be really helpful. Yeah, I mean, I graduated during the pandemic and still got a job, no problem. So if that's reassuring for you in terms of the career field, that's like a good thing. It messed up the timeline some, like the interview process and everything was delayed. And I know some people like institutions were put on hiring freezes, but like even amidst the pandemic, all 10 of my classmates and I were able to get jobs within 2 months of graduating, which I think is like really reassuring. But yeah, otherwise, I think it's super exciting. Like Paige said, just look into it, and you can always reach out to us as well, or at least myself, not to speak for you, Paige, but if you have questions, you can find our contact info too. And I'm happy to chat.
Actually, do you guys real quickly, would y'all mind putting your email in the chat? You can also get it from me if it's okay with you guys, but I don't want to speak for y'all.
Yeah, I could go. I also am okay with any student contact. I'm typing mine right now. The other thing too that I want to mention is there is a whole field of laboratory and industry genetic counselors that do something entirely different than Cara and I. And these are genetic counselors that work for laboratories, writing genetic reports and classifying genetic variants and stuff like that. So that's a whole other subspecialty that I don't have any experience in, but they are also, that's another path that genetic counselors can take aside from just a straight up clinical role.
Okay. Well, Cara and Paige, thank you so much. This was great. I feel like we had a small but good group, and it was great information, and we appreciate you guys so much taking the time to do this.
Thank you all for the great questions. It was nice meeting you.
Yeah, thank you. Become genetic counselors. It's awesome.
All right. Take care, everyone.
Thank you.
Thank you so
Bye.
much.